Let's start with the next topic, that is anatomical snuff box. So this anatomical snuff box is a triangular depressed area. So when you are hyperextending your thumb, okay, on the lateral aspect of the dorsum of the hand, so this is the dorsum of the hand lateral aspect, a triangular depressed area is seen. So this triangular depressed area is seen, and this triangular depressed area is called as anatomical snuff box. It is important for us to know the boundaries of anatomical snuff box. We have to know the contents of anatomical snuff box. Also, we have to know the roof and the structures crossing the roof of anatomical snuff box. Okay, so let's write it here. So I would also like to show you the diagram, and you can understand the boundaries of anatomical snuff box. So when it will be visualized, this triangular depressed area can be visualized once you hyperextend your thumb. So see this diagram. Let me just enlarge this diagram. So firstly, just concentrate on this diagram. So here you can see the anatomical snuff box is a triangular depressed area which is bounded between the tendons of. So you can clearly see it is bounded between the tendons of extensor pollicis longus muscle, and this extensor pollicis longus muscle is extensor pollicis longus muscle tendon is forming posteromedial boundary. Extensor pollicis brevis and abductor pollicis longus, these are forming anterolateral boundary. So here you can visualize this tendon. This is the extensor pollicis longus tendon. These are the tendons of extensor pollicis brevis and abductor pollicis longus. The triangular depressed area which you are seeing, which has been shown with the yellow color, which is lying in between, is the anatomical snuff box. The structure which is the content and lying inside is the radial artery. Radial artery pulsation can be felt in the anatomical snuff box. Other than that, I would also like to show you this diagram, where you can appreciate the radial artery is shown in the red color. So here radial artery is shown in the red color, which is the content. But other than that, it is having scaphoid bone and trapezium bone as the floor structure, and also in the roof it is having cephalic vein and superficial branch of radial nerve which is traversing. So I would like to write these points for you so that you can revise it later. So write down anatomical snuff box boundaries. So when I am talking about the boundaries of anatomical snuff box, it is bounded anterolaterally by the tendons of extensor pollicis brevis and abductor pollicis longus. Its boundary posteromedially. So it is bounded posteromedially by the tendon of extensor pollicis longus. Content. So the contents, we have got one important contents located in anatomical snuff box, radial artery. So on deep palpation, you can see the pulsation of radial artery in the location of anatomical snuff box. Also, the floor is formed by, if I talk about the floor of anatomical snuff box, it is formed by the carpal bone. The bones are, it is formed by the scaphoid bone and that of trapezium. It is formed by the scaphoid bone and that of trapezium. When I am talking about the roof of anatomical snuff box is formed by skin, superficial fascia, it is formed by the skin, superficial fascia, and the other structure which is forming the content and lying below is the superficial branch of radial nerve. Superficial branch of radial nerve is traversing into the roof, and one vein, that is cephalic vein. At times, cephalic vein can be utilized in the roof of anatomical snuff box for draining blood sample. Now, so before ending this topic, I would also like to tell you about the anatomical snuff box. I would like to tell you about its clinical aspect. Actually, at times the anatomical snuff box area is quite tender, and when it is tender when it is associated with the fracture of the scaphoid bone. So tenderness in the region of anatomical snuff box, the reason is the fracture of scaphoid bone, and the blood supply of the scaphoid bone is very, very particular. Actually, more of the blood content is received from the dorsal aspect as compared to the proximal aspect, and it can lead, if untreated case is left out, what will be the outcome? The outcome will be avascular necrosis. So this is also commonly seen in case of anatomical snuff box tenderness. If the case is not treated as early as possible because of peculiar blood supply, and the major source of blood supply of the scaphoid bone, which is occurring from the dorsal aspect as than the proximal aspect, there can be the injury to the blood supply, and this can lead to the case of avascular necrosis. Actually, long lasting cases, if it is a case of long lasting untreated case of anatomical snuff box involving the fracture of scaphoid bone, what you can say, it can also show arthritic changes. So it is very important that the case should be diagnosed as possible, as early as possible, and a prompt treatment should be done. So we have done with the boundaries. What is important for your examination point of view is that to know the boundaries of anatomical snuff box, it is important to know the boundaries, where it is located, when it is visualized, what is the content, what are the floor structure, and what is traversing through the roof of anatomical snuff box. So thank you. All the best.